Hello, everyone, and welcome to today's episode. I am Lorena Cosentino, Executive Vice President of Empire Medical Training, and today's conversation is especially close to my heart. We're talking about something that affects millions of women: hormones, menopause, and what it means to find balance in the midst of it all. I never shared this part of my story before. It was a difficult season of my life, full of uncertainty, questions, fear, and lots of emotions. At just 29 years old, I received a cancer diagnosis that led me to complete hysterectomy. I have never imagined facing something like that so young and navigating hormone therapy while still trying to understand what was really happening to my body. It was overwhelming, deeply isolating. But today, I want to share my story with freedom because I believe that it can be a light for another woman who may be walking through her own quiet storm. Hormone health should never be a taboo topic, no matter your age. Life forced me to learn that the hard way. And now my mission is to make sure other women are informed, supported, and never feel alone. Joining me today is someone I truly admire, Dr. Faride Ramos. She's double board certified physician in internal and functional medicine, based in Fort Lauderdale, Florida. Please welcome Dr. Faride Ramos.
Hi, Lorena.
Hi, thank you so much for being here with us today.
My pleasure.
I really appreciate it, especially talking about something that it really means a lot for us, right? Like
Yes.
hormones and functional medicine.
Yes, as you were mentioning before, it's really still a taboo conversation in the community. A lot of people, they really don't know much about it. They have a lot of fears. There is a lot of misconception in the community because they feel that hormones, they can create cancers, right? So this
Yeah.
is very important what you're doing, and I'm very thankful and very grateful that you invited me to really educate the community, to educate you, and to start really making the change that you need to.
I really love, I really love talking about this with you today. But before we start, I want you to tell me a little bit more about yourself and sharing your story with everyone here.
Yes.
So how did you decided, what inspired you to get from internal medicine to functional medicine?
Yeah, so, well, I was doing my conventional internal medicine for over 10 years and really not getting any answers. My patients, they were still complaining of the same symptoms. I'm tired, I don't sleep, I have problems with, my mood, my sex drive. And always, unfortunately, in conventional medicine, we are more disease driven. We get to, let's say, whatever is the medication that the patient needs without knowing exactly what's the root cause. So
Yeah.
that's what really, take me to that next step of, okay, why exactly we are treating these symptoms? What is it behind the symptoms? And to start the healing process. So that question was what it really triggered me to study functional medicine, where really it's complementing conventional medicine. It's the best of the Western and the Eastern medicine together.
Wow.
And that is what, I started studying more and getting all the different credentials and specialties. And I started first with hormones because there is
Yeah.
such a lack in the community about hormone education properly done. And that's where, I started doing a fusion pretty much, because I never just say, okay, I'm just going to do functional medicine. I'm doing what's called integrative medicine.
So, to tell you the truth, that was one of the reasons why. So Dr. Faride is also my doctor, and we go over hormones and everything, about just health overall. And that was one of the reasons I chose you to be, the doctor that I needed it, because you knew not just from the internal, but also from the functional, and I needed that support. So I'm glad that I met you also.
Thank you.
As a patient.
Yes.
So let's, dive into hormones, right? Like, what are really the characteristics between premenopause and menopause? Because I know it's a lot of information that sometimes we don't know why our body is reacting the way that it is.
Correct. So there is, in talking about misconceptions in the community, that, okay, you already turned 40 or 50, then definitely you're going to get into hormonal changes. And that's not really the truth, because there is so many women that they can start, having the changes even before 35 years of age. So in reality, it's when your body is just giving you manifestations, just listen to that.
Yeah.
Because that's when we start navigating into all those symptoms, and we start doing the testing. So it can start as early as 30. And
Yeah.
I have actually patients even younger than that. So
Wow.
that's what it's called. It's an early menopause, which is less, likely to happen, but it happens.
Yeah.
So manifestation. So listen to your body. And then we have to corroborate. We have to confirm with laboratory testing. And labs, not only blood, we have saliva, we have urine tests that we can really get to confirm what the final diagnosis is. So if you are going through changes, which can be hormonal, it can be manifested in sleep changes. It can
Yeah.
be manifested in your mood.
Yeah.
It can be manifested in headaches, in sleep, too much or too little, and the quality of sleep. In your bowel habits, if you're getting constipation or diarrhea. So it's many different ways that our body is showing those symptoms.
In my case, when it happened, when I had the complete hysterectomy, I remember like the next day or 2 days after the surgery. Of course, it was a massive surgery, but I really felt like no energy.
Yes.
It was like, what's going on? I felt like an old lady, and the more days was going by, I
Right.
felt even worse and worse. And the ugly part of that, I remember I couldn't do any type of hormone replacement
Yes.
because of the cancer, and
Yes.
had to wait like at least a year and a half or two before I could start. And like you said, it's a taboo. So I was so scared because I didn't know, like, okay, so where do I go now? And if what I'm putting in my body is gonna cause again cancer.
Correct.
I had a lot of fear because again, the information is out there, but it's so important to trust where you're going.
Correct.
And the physician that you're, really trusting your health.
Yes.
Right.
Your
So
life.
Your
And
life.
pretty
Your
much,
life,
yeah.
pretty much. So, and these, led me to the next question. And of course, like you said before, the symptoms are not just, in this case, a lot of women, they say, oh, I'm starting getting the hot flashes. So I'm going through premenopause or menopause, right?
Yes.
So that's just not it, right? Like,
Yes, or changes in the menstruation.
Changes
it can
in the
be so
menstruation.
many other symptoms, and that's why it's important, as you were mentioning, that you need to find that good educated professional that knows how to treat hormones, because they are very complex and they can be very similar in between. It can also be similar to thyroid problems, which
Yeah.
they all go hand to hand. So when you have one hormonal imbalance, you have to really look and see if there is any others that are also imbalanced, because there has to be in symphony. They always need to be, it's having like an orchestra. If you have them all in a good symphony, your body is gonna show that way as well. So it's internal. You're gonna manifest in the skin, in your energy, in your everything, pretty much in
Memory.
your mood, in your memory.
Yes.
So it's healthy longevity, because nowadays we know that the community and population are getting older, but what quality of life they're having right now.
Yeah.
If we're not really taking care of your nutrients, which is another aspect in
another
functional
aspect in
medicine,
functional
and that's
medicine,
where
yeah.
in my practice I always check what are you eating, how are you eating, in
Yeah.
the blood tests.
So how do you start? Like, what are your first tests? How do you start a patient into a better, longevity, health, overall? How do you
Yes.
start them?
So that's number one. So
Uh-huh.
the nutrient testing. And the nutrient is just a blood test. There is also urinary testing. So we check it specifically, instead of just randomly taking multivitamins and without knowing, is that enough, or really is it getting to where it should be, which is a cellular level? So we need to really get to know exactly, cellularly speaking, which is where everything happens, energy, hormones, detoxification. So if you're really getting to a good level, so we do that. We can test. So no more guessing. Testing is the answer, and obviously correlating with your symptoms.
Yeah.
So that plus hormone testing, as I was mentioning before, we do a blood test, we do a urine test, sometimes a saliva test.
Saliva,
so
uh-huh.
in adrenals, which is another aspect in the cortisol, which a lot of people, they are like, what is that hormone?
I had a test not too long ago in your office that I think it was nutrients, and then you
Yes.
detected that in one test vitamin D was okay, but then in this one it was lower than it's supposed
Yes.
to be, right?
Correct.
What is that test?
Because it's the nutrient testing. So we check in blood, it's outside the cells, but that is not really what is happening. Functionality wise, we need to check inside the cell. So in your case, for instance, we saw that it was normal outside, but inside it was low.
Yeah.
So that's telling me that it's not really getting absorbed. It's
Yeah.
not getting where it should be.
And it's so, I would say magnificent that we just don't have to do hormones. We can also do IV therapies now, right?
Exactly.
That it really puts back all the nutrients that we need. And once you finish that treatment, you feel like, oh my God, you feel just a little bit more
Energized.
like, energized
Yes.
for sure.
Yes,
yeah.
yes, and awake. And a lot of people, they also refer
That
that
is-
like I'm like
Awaken.
awake,
Yeah.
you know, because again, if your brain is lacking all these nutrients that they are a huge role, you know, in terms of producing the chemical messengers in the brain, and you are lacking some, you can feel that difference right away because you are bypassing the gastrointestinal tract, the stomach and the intestine. So it's going directly in the cell. So that's where it's important to know exactly, but every person is different. You might not need an IV infusion or you need a specialty type of infusion. So
Yeah.
if we test, we know, and if we correlate with your symptoms, we'll know and we'll, you know, define and direct whatever it is a therapy that is going to be the best fit for you.
So talking as a patient now, for example, like, you know, I do, you know, a lot of women out there, right? We try to have a, you know, a healthy, balanced diet, right? Now
Yes.
we went to a specialist, somebody like yourself, and we got into our hormones, into our special vitamins, IV therapies, and all that. What else can we do to feel, you know, better overall? You know,
Yes.
lowering our cortisol. Like, what else can we do? Like, I want you to. I kind of know already because I exercise every day.
Well, yeah, you say one of the answers, exactly.
Yes.
So exercise, but exercise, not overdoing.
Not
That's
overdoing,
important.
yeah.
That is important. So what type of exercise? Because that's another problem that in the community is like, okay, everybody needs to work out like 4 or 5 times a day. If you overdo, also that can be a problem for your cortisol. And cortisol is the mother of all the hormones, and then the others are gonna get affected. So you want to have a good balance
Yeah.
between relaxing exercises and active weight training resistance that is gonna help the, you know, your natural hormones to start boosting by itself, testosterone, your estrogen, and so on. So it's always that balance between a passive and an active exercise. And when I say also passive, it's targeting the vagal, you know, a nervous system. So you want to really get to breathing exercises, relaxing, decompressing. Breathing is more diaphragmatic than chest. So things like that, that is really gonna complement your physical, more active type of exercise. That's a good balance. And another very important is your sleep. If you don't
yes.
sleep, you don't regenerate. So everything starts there.
I'm so happy that you that you told me to take ashwagandha.
Yes.
I don't know if you guys are taking it or not, but ashwagandha really lowers your cortisol levels. Dr. Faride prescribed that to me. Well, actually, she recommended to buy one specific one, and it really helps me, you know, to sleep.
Yes.
You know, it relaxes me because it's lowering the cortisol levels, right?
Yeah, so it can act in both ways. It can up or lower. So every person is different. In
Yeah.
your case, obviously it works well, but you always want to run it by your physician. So that's one of the examples of adaptogens, which they also work in the adrenals. And if you want to really get to know more, like what other adaptogens, there are too many. It all depends on what your situation is and what will be the best fit for you for those specific supplements. But that is very important in the sleep, then in the colon, and you know, if you are going to the bathroom properly, which is another way that we can balance our hormones and healthy longevity. So having a good GI, which is gastrointestinal, upper and lower. So if you're having any reflux, if you're having a lot of distension and gases, that's not normal. And you should not be just masking with, you know, pantoprazole and any medications. Yes, it's okay for a short period of time if it's needed, or other conditions that they require. And again, in functional medicine and internal, we really distinguish and determine, okay, yes, for this period of time, along with a gastroenterologist. So the idea is that it's a teamwork. We put it together and we determine, okay, what is good, because if not, other side effects can happen. Dementia and osteoporosis and so on, and so on. And that's why hormones is also important, talking about other conditions, because that can lead to chronic inflammatory autoimmune, such as osteoporosis, dementia, heart problems. So it's not the opposite, like a lot of people, they think, oh, because I'm doing hormones, then I'm gonna end up having a heart attack or a stroke or cancers.
Yeah.
That was, you know, all concept old school, because that was when there were synthetic hormones, and we're talking here about bioidentical hormones, which is a completely different topic.
Yeah, and that is like so overwhelming as well, because there's so many different products. And also, what is the difference between bioidentical comparing to synthetic, right? Like
Exactly.
that is what is the difference, you know,
Yes.
because a lot of people, they talk about that.
Yes.
And you were prescribed bioidentical for me, which is, I believe, the healthiest, the best one for
Yes.
absorption,
Correct,
right?
correct. So it's plant-based. It's more the structure of the actual hormone. So we're talking about plant-based. So the chemistry is completely different than synthetic hormones, which they don't come from plants, and the structure is completely different. And also the doses that we use, or the dosages, are completely personalized, versus the one that are synthetic is just a standard dose. They really don't get to go to a intermediate dose if it's needed. So those are, you know, one and two different, options that we have. And another option is the ways that we can administer those hormones. So we have hormones in oral, transdermal, and we have pellets and many different others.
Yeah, so
Which in synthetic hormones, we don't have that option.
we don't have that option. Oh, okay. So yeah, I heard, I don't know if this is a myth or not, about like, at least me personally, about the pellets. I'm a little bit more like, concerned doing it. That's why I'm still doing like creams. So what will be your suggestion on like women overall to be using either creams or pellets? What is the difference?
Yeah. So again, it's very personal. So when you go and see your physician, that it should be specialized in functional medicine, they can, determine what will be the best options depending on what your symptoms are and what your lab results are showing. Because every person, let's say, you might not react well to a cream, and maybe a transition is to go to a pellet. And there are patients that they say, I don't have time for a cream, I'm gonna forget. So definitely that's not even an option. So a pellet is just an implant that is gonna get dissolved slowly in the system, but you want to really get to know if you are a good candidate for that or not. So it's not like, okay, everybody jumps into implants or pellets. It's not a good idea, or everybody into creams. That's why it's an art. We really need to get to determine what is the best way to really paint,
Right.
and get to that perfect healthy longevity for you.
What is really working also for you, right? Because you
Exactly.
can react differently for
You can
each.
react differently, and that's
Yeah.
important, how you do a continuity of care. Not just one time. You have to see the patient in 3 months, and maybe even sooner than that.
Yeah.
And then 4 months, it varies
Yeah, I
case by
think
case.
I think it's so important to keep going, not just twice a year to your doctor, especially doing hormones. I think we
Yeah.
do it every quarter.
Every quarter,
Every quarter we get
ideally.
measures again.
Correct.
So you see, you're not alone. It's a
Yes.
lot of different treatments, protocols. Everything that you can do and really improve, right?
Yes.
Your
And prevent.
and prevent. That's so true.
Prevent.
Yeah,
Prevent
because
is
what
key.
happened if like I have so many friends, all right, that they're like, oh my God, I don't have any energy. Like, how do you work out, or like, every day? How do you work out every day?
Yeah.
I'm so tired.
Yeah.
And I'm like, have you checked your hormones?
Exactly.
That's so important, because people really don't know why they feel so tired, or something else that, women or men overall, they don't want to talk about, right? Like
Correct.
sexual health, right?
Yes.
Like, is it painful or not?
Yes.
It's something that we really need to bring up to a specialist like yourself,
Yeah.
because it's really, like I said, a lot of resources.
A lot of resources.
Yeah.
You just need to be, you need to open up to your physician, and
Correct.
again, like someone that really has all the different, credentials, and they know what they're doing, because it's very tricky, it's very picky, and it's a very sensitive area. So
Yeah.
nobody can just jump into hormones because I want to feel better and I
No,
don't
no.
want to get old. It's not like that. So it's like thyroid. It's the same thing. So just be responsible. Education is also the best way to really and empower yourself, advocate for your health, because that's what's all about. Yeah, your health is your wealth. I always tell
Yeah,
my
your
patients,
health
it's
is your
either
wealth.
investing in your prevention and your health, or is spending in disease. So those are the two choices.
Yeah, no, definitely, I agree. On your health is your wealth. Without health, we really
There's
there's
nothing.
nothing. Yeah.
There's nothing.
So we talk a lot about our physical health, but how about if you ever felt that just wanna like hide from the world? You wanna have a spiritual retreat, or like a silence
Silence
retreat.
retreat. Oh my God, yes.
Oh my God, right? So how hormones play on that? Because that happens to me once in a while. I
That
just want to
happens to me
escape.
too.
I want to escape from the world.
I think it happens to all of us, and also to our significant others.
Oh,
They can
yeah.
also relate to that, because they get the impact of hormonal changes. And that's why it's important that you notice all these, as you were mentioning, not only the physical part, but also when you feel like those mood swings, very edgy, irritated, crying for everything
Oh
and
my
anything.
God. Yeah.
Like, it's like, okay.
Since I started estrogen, I just cry for him. Like, oh, why it's
Yes,
so cute. Yeah,
yes.
I know
It's
that
this roller
happens.
coaster. So that's
Yeah.
where you really also want to pinpoint, okay, is maybe my hormones
Yeah.
that I'm going through all these mental health changes, because that's where we have to take action, and don't wait until it's too late and then you're really either depressed, anxious, or many other things that it can happen related to that.
So when I noticed really like the mood swings, when I had the surgery, all of a sudden I was just fighting with everybody in my family. My sisters, my mother, it was like, oh my God. And they were like, what's wrong with you? I'm like, I don't know what's happening,
Exactly.
I was overly angry, and I didn't know why until I kind of like talked to the professionals, and of
Yes.
course that was one of the reasons as well. So ladies out there, if you're getting a little bit,
And you guys also.
angry. Oh, and the guys
Bring
too.
your ladies.
Yeah, I think it's super important to have your
Yes.
hormones balanced, right? So it's
It's
no
happy
fighting.
for both.
It's-
Win-win.
Win-win situation for both.
Yes.
Yeah, it's so true. So Dr. Faride, what it will be your advice for those medical practitioners that want to get into functional medicine and hormones?
Yes. So definitely the education, as I was mentioning before, it's very important where you go. It's key to really get you to a very good, consolidated, strong, background that is going to help your patients. So at Empire Medical Training, we have many different certifications that you can start exploring. So there is the anti-aging, there is the IV therapy, there is the nutrition, there is the weight loss, that is all in tune with functional medicine. And that's a very good way to really start to deep and dive in more into this type of medicine, because you really want to integrate both, if that's what you want, or even the other healthcare providers. Like,
Right.
not necessarily has to be a doctor, but if there are nurses that they want to pursue, and get more into functional holistic medicine, this is also a way that we can integrate it in the practice.
And that makes me really very proud, because we are here at Empire. We just don't teach about aesthetics. We really compose it in a way that it's health from inside out, and talking about anti-aging, functional medicine, and just like health overall. It's really something that most medical practitioners are going to be able to offer that to their patients. So yeah, that curriculum that we have in anti-aging and functional medicine, it's thank God we have a very good
Complete.
one, a complete
Yes.
one. Dr. Faride, thank you so much for being here
My
today
pleasure.
at this podcast, especially the deep conversation that we have. I really appreciate all your insights and be able to share, so much information with our audience.
Of course, anytime.
If people would like to learn more about you, where can they find you?
Yes, of course. You guys can come and visit me. I'm in Walton Manors in South Florida. And you can also follow me this is my Instagram. And also you can go to my website, www.drfarideramos.com, or you can call my office, 754-732-4300.
Thank you again. For the women listening, whether you're in premenopause, full menopause, or recovering like I did, you are not alone. You deserve real answers, real care to feel like yourself again. To our healthcare professionals, if you want to learn how to offer this level of care, Empire Medical Training offers in-depth courses in hormone therapy and functional medicine. We are here to help you expand your practice and change lives. If these episodes resonates with you, please share it with your friends, your sisters, your colleagues. Together we rise, we heal, we thrive. To stay connected with us, subscribe to our YouTube channel or visit us at empiremedicaltraining.com.